We had the opportunity to test the system here over the last few weeks, and I must say that I was very impressed. I especially like the many different options it offers. You can work with a 3D system, an optical system, and even a headset, which allows you to maintain a very ergonomic posture, sitting upright, because you have a clear view of the monitor. There is no need to turn your head or body to the side. The resolution, image quality, and color intensity is good. These are the characteristics that surgeons consider important for everyday clinical practice. Working with a smaller monitor was also a new experience. After the test phase, I have to say that I find it very beneficial, because its maneuverability and flexibility naturally open up so many possibilities. There is no long viewing distance anymore, which could be blocked by the anesthesiologist when needing to access the patient. They can now work on the patient undisturbed behind the smaller screen, and I can simply continue operating. This is not only appreciated by the anesthesiologists, but also by the nursing staff, who find it convenient not having to move around the usual, larger monitors. We are a larger clinic where there are over 30 surgeons. And we are a university hospital, so we also have students who come with us into the OR, and, with conventional systems, what they are able to observe is rather limited. With a 3D system, where they see exactly the same thing as the operating surgeon, the learning experience is naturally much better. In addition, there is the option of working with a headset, which I found very exciting, because I never had the chance to do it before. Your peripheral view is unobstructed, which means you can still see what the nurse is doing at your side, making it easier when it comes to using the instrumentation. So it was really a brand new experience, very exciting. The ability to switch easily between conventional optical and 3D systems without disrupting the surgical workflow plays an enormous role.